The experience that inspired us to start this business was my mom. So my mom was very independent. She was living alone in her own apartment in Brooklyn, New York. And she really did not want to burden us with anything. When she became ill, she didn't tell us.
5 years before she passed, it was evident that she started to slow down. She was getting older, yet she clung to her independence, adamant about living on her own.
We started to notice that she was getting a little bit weaker and just wasn't as vibrant as she used to be. Subsequently, she had a fall and it resulted in her breaking a hip.
She had fallen. It was one Sunday. She was coming from church and it was raining outside and she fell.
After this point, when she was in the hospital, I had the opportunity to talk to some of her physicians, and we found out that there were actually a few more things going on that we weren't aware of. As a result of that, the broken hip, she wasn't able to go home. She ended up having to go to a rehab facility. During that period of time, our siblings and myself, we went to visit her and we would take turns helping her in the rehab facility. After this, we realized that she really shouldn't be living by herself, and with great discussion, she agreed to move in with my brother and my sister-in-law.
Thankfully, within 4 months or so, by the end of the summer, she was recovering well and agreed to live with us. But our mother would avoid these conversations, which was especially hard for my sister Laura, a doctor.
That's when we found out there was a lot more going on with our mom, stuff that she didn't really want to share with us, and that her health was actually in a dire situation. She asked me to talk to her physician, and I did. And much to my surprise, we found out that my mom had a devastating illness, one that she chose not to share with us. So I talked to my mother about it, and she knew this was going on, but yet she didn't want to share it with us.
And so when we learned that my mom was dying, being a family of healthcare professionals, I wanted to have that conversation with my mom, and it was difficult because you never think of your parents as elderly or dying. My mom was always very active.
Progression from diagnosis to her passing, it happened in just about a month. It was a shock. Our family rooted in healthcare found it particularly difficult to see her slip away so quickly without a proper plan.
I knew we needed to address her end-of-life care and what would she want. So I gathered all of the documents. I had a living will, advanced care planning, and one of the things I discussed with my mother was, what would you want us to do if we found out that you had a terminal illness? How would you want us to take care of you?
I said to my mom, this is a conversation that I have with all of my patients, trying to normalize the conversation. And I asked her, if something were to happen and you needed to go into the hospital, be on the ventilator, is that something that you would want?
She just put her hand up and just said to me, you know how I've lived my life. I trust you all to make the right decision. You know, and one might say, boy, what do you do with that? But I took it in and I understood, because of all the years that I was with my mom, I knew there was things that she wouldn't want us to do. But I think it is better if you are able to get that person to really articulate it, put it into words, and be able to document that. And you may not be as fortunate as us in the sense that we had a family that truly understood what her life was about and how she lived her life and how she wanted her end to be. But there are some families that may not have that advantage. And if you don't, being able to sit down with somebody, talk about what you want, be able to document it, could save you a lot of heartache. And that's one of the things that we want to do with our business, and that's how it was born.
OneAccord specializes in helping families through these crucial conversations. And we're here to help you in any way that we can regarding the end-of-life planning. Death can strike at any time. Don't get caught off guard. Plan today.